Hi, everybody. I wanted to go over your cardiac quiz so you could get started on your remediation and get that turned in. So first I want to say that as instructors, we're a facilitator. We are an educator to help you learn and understand not only information, but how to process that information and critically think. So the NCLEX questions that I'm going to discuss are truly NCLEX questions. There's not a debate about what's the right answer. I'm going to share the right answer with you, and I'm going to help you to understand why it's the right answer. So I want you to listen and try to get past the fact that your answer may not be the correct answer, because understanding why the answer is correct is going to help you to answer questions in the future for NCLEX. So recognizing those patterns of questions and using information that you know to answer questions. So let's get started. The first one, the question was, the nurse enters a child's room, finds him unresponsive. After determining that the child is not breathing and does not have a pulse, which of the following actions should the nurse take first? So let's remember, you're not a bystander. You did not come upon this child alone and you have to leave them to call for help. You're the nurse. You're walking into your patient's room. So that means that you're going to assess your patient, you're going to call for help, and then you're going to provide care. So let's look back at the question. It says the nurse enters the child's room and finds them unresponsive. Are you okay? Are you okay? We do our assessment based on that. We've determined from our assessment they're not breathing, they don't have a pulse. We've checked airway, breathing, circulation. What do we do next? After assessment, we call for help. Push that code button, yell, I need help in here. Then we start our care of the patient. Okay. Question number 2. Oh, I'm sorry. First one, A, summon the code team. Second, the parent tells the nurse that they are concerned because their pediatric provider told them the child has a heart murmur. The nurse should explain to the client that a murmur is what. So how would we explain that to the patient, or I'm sorry, to the family? So when we talked about cardiac, we talked about that the valves opening and closing, especially when we talked about rheumatic heart disease, that the valves, whether we're talking about the tricuspid and mitral valve, or whether we're talking about the aortic and pulmonic valve, when they open and close, they should have a very tight closure so that no blood seeps through. And when someone has a heart murmur, that indicates that there's damage to the valves, and that could be from a virus or bacteria, or it could be from extra pressure on the heart. So what that really is it's blood flow rushing through those valves that are trying to stay closed, but they don't have a really good seal because the closures are damaged, so they don't fit together really well. So that's turbulent blood flow through a valve. Okay, so that's number D. Number 3, a nurse is providing teaching to the parents of a 1-week-old infant who has a prescription for home oxygen and a pulse oximetry monitoring. Which of the following statements by the parents indicate a need for further teaching? So we are providing teaching to these parents at home. We could be somebody in the hospital that's giving teaching before they leave, so discharge teaching, or we could even be a home health nurse in the home. So providing statements that indicates they have a need for further teaching is asking which one of the statements below is not correct. So we want to look for something when we would read the answers that are given for the question. Which one of these is not correct and why would it not be correct? Okay, if there's any part of it that's not correct, then it's not correct. Okay, so let's go through them. The first one says, we will rotate the probe of the pulse oximeter every 24 hours. Why would we rotate the probe or the sticky part of a pulse ox? Skin breakdown. Okay, children, infants have skin breakdown. They're very frail. We always need to assess for skin breakdown of anyone who has a medical device. That could be EKG leads or a Foley catheter, oxygen tubing, telemetry stickies, and a pulse ox, because that is putting pressure on your tissues. So we need to take it off. And every 24 hours for an infant is not sufficient. So at least every 4 hours, we need to take that off. We should truly be assessing for skin integrity and blood flow every 2 hours. So 24 hours is not adequate for that. Let's read the other ones. The probe of the pulse oximeter can be applied to a finger or a toe. This is true. We can put the little sticky finger, toe, ear, forehead. We can move those around. We should be moving them around every time that we take them off and check them to avoid skin breakdown. Pulse oximeter might not be accurate during times of excessive movement. And this is true, whether we're talking about rolling in the bed, we're talking about crying, we're talking about feeding, we're talking about when there's a diaper change. Those type of activities can cause increased heart rate. It can cause increased use of oxygen. And so that movement may not be accurate because it could be moving the probe around. And then we will notify the doctor if the pulse oximeter consistently reads 100. No, that's okay. That means they're getting excellent perfusion. That would be okay. We don't want to notify the physician if that's a normal finding. Okay. Number 4, a nurse is providing discharge instructions to the parent of a 10-year-old child following a cardiac catheterization. So we talked about cardiac catheterizations. Which of the following instructions should the nurse include? So what would we talk about after a heart cath? So post-procedure teaching. Keep the child home for 1 week. No, they don't have to stay home for 1 week. They need bed rest with the leg, if we're going in the groin, extremely straight for 4 to 8 hours, okay? Depending on what they've done, okay? Pressure, whether it is a pressure dressing or whether it is allowing time for that catheter insertion site, if we're talking about the groin, to clot. Okay, so keeping that leg straight, bed rest, 4 to 8 hours, not a week. Keep the child or give the child acetaminophen for discomfort. Yes, so we can give acetaminophen to a 10-year-old child, and there is discomfort. We're going through the skin, it's percutaneous, so they will need something for comfort. Offer the child clear liquids for the first 24 hours. They don't need clear liquids. We can resume oral intake as tolerated the same day. And assist the child to take a tub bath for 3 days. Why wouldn't we want them to take a tub bath? Why would that maybe not be correct? So we have an open wound that is at risk for infection. So we want them to avoid soaking in a tub for up to 3 days. Keep the dressing clean and dry. Assess the site for any redness or drainage or bruising, and do a shower or a sponge bath. Okay. Let's look at number 5. Nurses assessing a 3-year-old child who has aortic stenosis. Okay. Which of the following findings should the nurse expect? So with aortic stenosis, we're talking about the aorta, and stenosis is narrowing. So narrowing of the aorta, and we know that blood flow leaves the left ventricle, has that great big squeeze, goes up the aorta. And so aortic stenosis is considered an obstructive disorder. There's something that is preventing blood from being pumped adequately through that aorta, and it's a narrowing of the wall of that. So let's look at the responses. Which of the following should we expect? Okay. With a narrowing aorta, we are decreasing the rate of oxygenated blood flow that's going to the body. So we're going to see signs and symptoms of decreased oxygenation getting to the body. Hypotension, yes. Low blood pressure. The reason this happens is that the blood vessels are trying to help and compensate. So they're opening up to help to increase blood flow that's getting to those areas that's not getting blood. Bradycardia. No, it's tachycardia. Tachycardia. The heart is again getting messages that the rest of the body is not getting oxygen, including the heart, because the heart has to be fed with oxygen through those coronary arteries, just like any other organ, and they're not getting enough oxygen, so it starts pumping faster to get that oxygenated blood out and around and back to be reoxygenated. Clubbing of the nail beds. Let's look at our child. We have a 3-year-old child who has aortic stenosis. Clubbing of the nail beds is only seen in long-term problems, and it's not an indication of aortic stenosis. Aortic stenosis is not a mixing of the blood. When we think about cyanosis, we're thinking about blood that's being pumped out to the body that has not been oxygenated yet. And that's not our problem with aortic stenosis. It's oxygenated blood that's getting pumped out. It's just that the heart has to work harder to get it past that narrowing. So we're not going to see cyanosis. Or I'm sorry, we're not going to see clubbing of the nails. Weak pulses, yes, because the furthest, especially when we're talking about peripheral pulses, the furthest we have to go from the body, from the heart, is going to be weak, because the heart isn't able to get past that obstruction to get that blood flow down and all the way back up. The heart has to work hard to pump the blood back up as well, and it's doing the best that it can to get it through that narrowed aorta. So we're going to see weakened pulses, especially peripherally, and then a heart murmur. So yes, putting pressure on the heart as it's working harder and squeezing as hard as it can to get past that narrowing can cause damage to the valves. Number 6, a nurse is assessing a client who has infective endocarditis. So it's an infectious process. It's usually from group A beta hemolytic strep. And endocarditis is the inner lining of the heart. And so it has inflammation and white blood cells going to the area. And it's putting more work on the heart. Which of the following findings should be the priority? So number 1 for the nurse to report to the provider. We're only going to report things to the provider that are abnormal, okay? So she's got indicating 2 answers. So which one of these things are abnormal we would report to the physician? Splinter hemorrhages to the nails. Okay, that is something that happens when the body isn't getting enough oxygen all the way out to the fingernails and toenails. Again, that's the periphery, the furthest part from the heart. What happens is those little blood vessels start to become broken and start to stretch out looking for more oxygen. It's kind of the precursor of the softening nails leading on up to clubbed fingers. So that splintering or that spreading out of those blood vessels in those nails indicates that we're not getting an oxygenated blood all the way to our fingernails. And that can happen when we have inflammation of the heart tissue, because the heart is not able to pump and squeeze and do its job well. Dyspnea, shortness of breath. Shortness of breath, yes, definitely, because it's not able to pump and squeeze and get that oxygen out the way that it should. It's working on a heart that's not 100%. So those 2 definitely. The last 2, afebrile and negative blood cultures, are normal findings. So we would not report those to the physician. Number 7, a couple's child is diagnosed with heart failure. Okay. Which of the following interventions would be an appropriate recommendation to maintain optimal nutrition? So we learned about heart failure. And so some of the things that we talked about to help get nutrition without wearing the child out, so that they're so tired and exhausted and have used so much oxygen demand that they're not able to feed. So how can we facilitate them getting in that nutrition without using so much of that cardiac output? A, replace regular nipples with easy to suck nipples to decrease effort in feeding. Yes, we talked about that in class. So those nipples that don't have as much resistance, so that they can use less effort to suck on them to get the formula or breast milk out and in for nutrition. They don't get worn out as easily, so they can take in more nutrition. Allow the child to feed for 1 hour. That's too long. Okay, so that they are going to get too worn out at that time. Provide large feedings that are evenly spaced over 4 hours. Again, large feedings are going to wear them out. We want to space out smaller feedings. And then give formula high in sodium and calories. That's not true either. We want formula with heart failure. Remember, they can hold on to fluid. So we want low sodium and high protein. That's going to help give them energy. Okay. Number 8, the Smith family is caring for their child with tetralogy of Fallot. Remember, tetralogy is 4. So 4 different disorders. Which of the following are defects associated with this congenital defect? Okay. So the correct answer is a ventral septal defect. So an opening between the ventricles. Okay. And that's normal pre-birth. Okay. Tetralogy of Fallot is when some of those adaptations before birth are allowing blood flow to bypass going to the lungs. And when the child is born, those things should close. And some of those things don't. And that's when that tetralogy of Fallot is diagnosed. So we have that ventral septal defect, the opening between the right and left ventricle. We have an overriding aorta. Okay. So the aorta is bypassing going to getting blood from the lungs because it doesn't go to the lungs. So it's overriding where that pulmonary artery goes to the lungs and is opened up. In the I want to say infant, in the pre-birth infant, the overriding aorta is getting blood flow that is going from the right ventricle and the left ventricle together to take up through the aorta. Because again, they're getting oxygenated through the placenta. They are not going to the lungs and circulating before birth. The pulmonic stenosis is a narrowing of the pulmonary artery. So again, we don't need that pulmonary artery pre-birth. We don't send blood to the lungs to be oxygenated. So that stenosis or narrowing it would be fine before birth. And then right ventricular hypertrophy. Again, this right ventricular hypertrophy happens because of that pulmonary stenosis that's present after birth. So it's due to that pulmonary stenosis, that right ventricle squeezing really hard to get through a narrow opening to send blood flow to the lungs. So remember that tetralogy of Fallot is truly some of those things that should be present before birth, but then change or evolve after birth to allow for blood flow to go to the lungs to be oxygenated before it goes out to the body. Okay, so that one was B. Number 9, the ductus arteriosus. So what's the ductus arteriosus? The ductus, or a duct or a pathway, and arteriosus, a pathway between the arteries. And so we think, what arteries? So we have the pulmonic artery and the aorta. And with ductus arteriosus, there is a pathway that goes between those. And so we think, what is the problem with that? The problem is that's our deoxygenated and oxygenated blood that are mixing together. And that's not good because we don't want deoxygenated blood to go out to the body. It's not able to carry oxygen or pick up CO2 for that matter and bring it back. It's not able to do that. So it says the ductus arteriosus is another fetal structure that is important in intrauterine life. Yeah, it is, because again, we're not sending blood flow through the lungs intrauterine. It is the right and left blood flow that are mixing together and being sent back out. So it is B. The ductus arteriosus shunts the combined cardiac output from the pulmonary artery to the systemic circulation. Again, a duct or a pathway between the pulmonic artery and the aorta. Okay. And then number 10, the nurse is assessing an infant with coarctation of the aorta. Which of the following findings should the nurse expect? Coarctation of the aorta is an obstructive disorder, and it's a narrowed portion of the aorta. So what would we see if we have a narrowing of the aorta and it is affecting blood flow that's getting out to the body? Weak femoral pulses, yes, because again, blood flow isn't as strong going through that narrow pathway, and it's not having that force of going all the way down to the extremities. So we're going to see some signs of decreased blood flow in those areas, as well as those very weak pulses when we feel them. They're not going to be good, strong bounding pulses, because that has to do with not only our heart rate pushing blood out, but our blood vessels accommodating and squeezing very good. And remember, when we're having problems with oxygenated blood getting through the aorta and getting out to the body, what do the blood vessels do? They open up to hopefully allow more oxygenated blood to get down to that area. So it's going to be really weak because we're not feeling that resistance and that stretching in there. It's just kind of open and laying there. Cool skin at lower extremities. Yes, oxygenated blood flow. We're going to see problems with oxygenated blood flow getting to our extremities. Severe cyanosis. No, again, it's not a mixing of the blood. So with coarctation of the aorta, not a mixing of the blood, it is going to be a narrowing. So problems with getting enough blood flow going out. So decreasing amounts, but we're not mixing with deoxygenated blood. And that's where we're going to see that cyanosis come in. Clubbing of the fingers. No. So this does not appear, number one, until after at least age 1, and we have an infant. And number 2, we're not going to see that clubbing with this disorder, because again, with our infant, it's going to be pumping and pumping and pumping, trying to keep up with that. We just have a decreasing capacity. We don't have a mixing of blood. And so the volume that we're getting is slow to get there, but it isn't being replaced with blood that doesn't have oxygen in it, if that makes sense. And then low blood pressure, yes. So low blood pressure, opening up of the blood vessels, okay? So we said we would see tachycardia, okay, when we talked about that before, the heart's working really, really hard, but the pulses that we're going to see distally, okay, so checking them, wrists, feet are going to be weak, okay? Blood is going to be getting the furthest away, slowest. So the pulses are even going to be different than the pulses that are more central. So listening to the apical pulse, feeling the carotid, even brachial are going to be more stronger than when we get further out from the body. So I hope this has helped. Again, purpose is to totally teach you how to look at these questions. It's critical thinking. I think it's a good way to say, what am I thinking in my head when I'm reading these questions, and how do I interpret them, and the things that I'm looking at. When I have something that's a select all that apply, I go again through each of the answers. And if something isn't correct, any part of that, I mark it out. So that's how I get to how many answers that I have with a select all that apply. Best of luck, guys. I hope you did fantastic on your final tonight, and I will see you soon.